identify various psychological disorders, what are the major symptoms that we want to be familiar with? Today we're going to take a look at a wide variety of different psychological disorders as they are listed in the DSM-5. We'll take a look at different symptoms to be familiar with, and in some cases, some possible causes of those disorders. Again, we're not always going to know the answer in regards to why a disorder develops. That comes down to a wide variety of biopsychosocial factors that can be involved, but there are some prevailing theories that we can look to and some research-based evidence that can help support those ideas as well. So to start, we're going to take a look at mood disorders, in particular depressive disorders. Because depressive disorders are a group of disorders characterized by persistent feelings of sadness, hopelessness, and loss of interest in personal activities. There are a couple of different versions of this that we want to know, so let's go ahead and take a look at what those are. The first one is major depressive disorder, commonly known in layman's terms as depression. There are a wide variety of symptoms that are associated with major depressive disorder, from depressed mood, of course, but there's also loss in interest or pleasure in daily activities, along with symptoms such as changes in appetite, and that could be changes in either direction, changes in sleep, which can also be changes in either direction, feelings of worthlessness or guilt, or thoughts of death and suicide. Major depressive disorder is usually diagnosed when these symptoms have been ongoing for an extended period of time and they don't seem to be getting any better on their own. A less intense but longer lasting depressive disorder is known as persistent depressive disorder, also called dysthymia. And this is a chronic form of depression that is characterized by milder symptoms, so they're not as intense as major depressive disorder, but they can last for 2 years or longer. One of the challenges with persistent depressive disorder is because it is less intense, people don't often recognize it as being a depressive disorder because they don't feel depressed. And as a result, they might not seek out the help that they need, even though they're getting little relief to their symptoms for a longer period of time. We also have bipolar disorder, which is characterized at this time by extreme mood swings that can include emotional highs, such as mania or hypomania, and lows that are associated with depression. The mania that we see in bipolar disorder can also exist on its own, and that is characterized by an emotional state that consists of an elevated mood, increased energy or activity levels, and often impaired judgment and risk-taking behavior. These periods can last for days or even weeks, and in the case of bipolar disorder, can then be followed by depressive episodes that can last for weeks or even months at a time. There are different types of bipolar disorders, such as bipolar 1 and bipolar 2, that explain the differences in the cycling that takes place between the manic episodes and the depressive episodes. Bipolar 1 is where we see the manic episodes that are preceded or followed by the depressive episodes. In these cases, we see severe mood swings that impair functioning. Bipolar 2, however, is characterized by recurrent depressive episodes alternating with hypomanic episodes, which is less severe than a full manic episode that we would see. The next category of disorders we have are anxiety disorders, and there are quite a few different anxiety disorders that we want to be familiar with as well. Anxiety disorders are typically characterized by constant feelings of fear or worrying that fit into the categories of the 3 Ds when they are dysfunctional or getting in the way of someone living their daily life. For example, specific phobias are different than the average fear because while we all experience fear from time to time, phobias typically interfere with someone's daily functioning. They prevent them from being able to do the things that they want to do due to this excessive fear that they are experiencing. Examples of specific phobias that you want to be familiar with are acrophobia, which is fear of heights, arachnophobia, which is fear of spiders, and agoraphobia, which is fear of the inability to escape from specific situations. This might lead to someone not leaving their home or a place of safety due to their fear of going out in public. Other types of anxiety disorders that we might see include panic disorder, which is characterized by recurrent panic attacks. These seem to come out of nowhere without having any specific cause tied to them, but they can be very intense and last for several minutes. And social anxiety disorder, also known as a social phobia, is where people have fear of being scrutinized or judged by others. Just like with depressive disorders, where we see versions that are more intense and less intense, we see the same thing with anxiety disorders. Generalized anxiety disorder, for example, is a longer lasting but less intense experience of anxiety. It is more so an ongoing feeling of fear and worry that can affect someone in their day-to-day activities, as opposed to specific situations or moments that are causing more intense fear or worrying to take place. Like with panic attacks, that can be very short-lived but very intense for the individual that is experiencing them. As mentioned earlier, cultural norms do play a role in the diagnosis of psychological disorders, and we also see the prevalence of different disorders in different societies as well. For example, there are a couple of culture-bound anxiety disorders that exist in both Latin America and in Japan. Ataque de nervios is one that exists in Latin America that is an anxiety disorder that is characterized by crying, trembling, or even physical aggression. And in Japan, the anxiety disorder is referred to as taijin kyofusho, which has a fear of offending others or experiencing some kind of embarrassment in social situations. And again, these are based on cultural norms and behaviors that we see within those societies that can lead to those symptoms manifesting that would lead to that diagnosis. Our next category of disorders are neurodevelopmental disorders. And these are going to be disorders that are characterized by changes in brain functioning that affect behavior, cognition, and social functioning. For example, attention deficit hyperactivity disorder, or ADHD, is one of these neurodevelopmental disorders. And it is characterized by patterns of inattention or hyperactivity or impulsivity, all that are going to interfere with daily functioning or living. Autism spectrum disorder is another neurodevelopmental disorder, and this one is characterized by changes or deficits in social communication and interaction. In some cases, we also might see either restricted or repetitive patterns of behavior, interests, or activities as well. The next category of disorders that we have is schizophrenic spectrum disorders. And schizophrenic spectrum disorder, also often referred to as schizophrenia, is in fact a group of disorders that are characterized by disturbances in thinking and perception, emotions, and behavior. They include schizophrenia, but there's also other related disorders as well. In this category of disorders, we often see symptoms such as delusions, which are fixed beliefs that are not based in reality and resistant to change. These are one of the hallmark symptoms of a psychotic disorder. People can have delusions of grandiosity, they can have delusions of persecution or someone out to get them. The delusions can be varied and diverse, but they are one of the most common symptoms that we see. The other is hallucinations, and hallucinations are perceptual experiences that occur in the absence of external stimuli. So this could be seeing, hearing, smelling, or feeling things that are not actually present. Hearing things are actually one of the most common types of hallucinations that we see in psychotic disorders as well, particularly in schizophrenia. In addition to hallucinations and delusions, some of the other symptoms that we see in these schizophrenic disorders include disorganized thinking, which can include thought processes that are disjointed or fragmented, or even illogical at times. And that can often lead to disorganized speech that follows, where the words that a person is trying to communicate are also going to be very difficult to follow. It could lead to rambling or using words in unusual ways, or loose association of words that are not quite connected and finding ways to connect them together. Physical symptoms that we might see in these schizophrenic disorders include disorganized motor behavior, which are going to be actions that we see that can either be repetitive or they're just not appropriate to the situation. So they might be agitated or unpredictable movements as well. Symptoms in schizophrenia and schizophrenic disorders often fall into two categories that are known as either positive or negative symptoms. You can think about positive and negative as being the difference between plus and minus, where we're either seeing the addition of new symptoms, things that we previously did not see, or with negative symptoms, we can think about taking away behaviors that we would expect to see in an individual. So negative symptoms can include things like lack of emotion. It's also known as flat affect, where there's just no emotional affect that is taking place. That is something where we would typically expect to see emotions, now we no longer see that. Or rigidity, lack of movement in an individual, where we would expect to see them moving around, that lack would be referred to as a negative symptom. Positive symptoms are going to be the symptoms that we've talked about so far. Things like disorganized thinking, hallucinations, delusions, things that previously were not there in an individual that are now the addition or new symptoms that we're seeing that fall into the positive category. And the development of schizophrenia often falls into two categories as well, both acute and chronic. Acute schizophrenia means that the symptoms came on very suddenly and very drastically and often require immediate intervention. Whereas chronic schizophrenia is where we're going to see long-lasting symptoms that are going to interfere with daily life functioning. As we mentioned earlier with symptoms of schizophrenia, delusions can come in a wide variety of categories. Sometimes the delusions are going to be of persecution, so that someone is out to get them, someone's going to hurt or harm them in some way, or delusions of grandeur, where they have beliefs about their abilities, that they are special or unique in some way, that they are famous or well known, even when they actually are not. And that disorganized speech that we mentioned earlier as well is sometimes referred to as word salad, where the words coming out are again not fully connected to each other, or maybe loosely connected by a group of loose associations that take place. When looking at negative symptoms, as we mentioned earlier, flat affect or lack of emotional affect takes place, and we can also see catatonia in our negative symptoms as well. And that could be the lack of mobility, where someone is sitting rigid and unmoving for extended periods of time. But it can also be a positive symptom where we see repetitive behavior. Again, there are a lot of different symptoms of schizophrenia, and they all manifest differently for different individuals. Sometimes we see excitement, so heightened agitation, restlessness, or hyperactivity, and sometimes we see catatonic stupors, where someone is going to exhibit very little activity. And while there are a lot of different symptoms that can manifest in different schizophrenic disorders, there are a couple of pieces of research that are helpful for us in understanding the causes. One theory involves prenatal virus exposure, where we find that individuals who are born after a flu season have a slightly increased risk in developing schizophrenia later on in life. And of course, the role of dopamine is one that has been tracked for a long period of time. Overactivity of dopamine is highly correlated with schizophrenia symptoms and seems to be a major cause. So when we look at treatment for schizophrenia, medications that lower dopamine activity in the brain seem to be one of the most useful treatment options available. And these are just a few of the many, many different psychological disorders that are listed in the DSM-5 and the symptoms we want to be familiar with. But again, hopefully by understanding the symptoms better, we can help reduce the stigma and find better treatment options for anyone impacted. So thank you so much for watching, and as always, remember, be kind to your mind.